Okay, today's topic is about stress, coping, and maladaptive behaviors. Next, what are the agendas we're going to see today? Stress, social support, and physiological responses and psychological responses. First thing, stress. Abnormal responses to an perceived threat or a pressure that disrupts an individual and the physical and the mental well-being. It will be divided into typical types and effects and triggers. First thing is about types. We have about two types. First one is acute stress, chronic stress. Acute stress responds to a specific event or a situation. Chronic stress responds as ongoing stress that persists at time. There are three types of triggers. First one is physical, emotional, and environmental. Physical is about illness and injuries. Emotion is about losing of loved ones, relationship issues. Environment is about work, finances, and social situations. We have three types of effects. First one is physical, emotional, and behavior. Physical is about headache, fatigue, and emotion is about anxiety and depression. Behavior, changing in appetite and sleep pattern. Next, we are going to see about the coping skills. Coping skills are the strategies which used to manage or reduce the stress. We have about three types of coping skills. First one is about problem focused coping, emotional focused coping, and avoidance focused coping. Problem focused coping and emotional focused coping is kind of a different thing. First one is about active. Second one is passive. Problem focused coping is an active solution which is have an oriented stages to address the source of stress. For example, problem solving, planning, plan seeking informations. Emotional focused coping is about an passive method which is about reducing the stress strategies and managing the emotional responses. Example, relaxation techniques, emotional expressions, and avoidance. Avoidance coping is an worst state of coping skill which has an unhealthy and short-term relief strategies that may worsen the stress in a long run. Example, substance abuse, denial, and escapism. And effective coping skills have a certain categories which is flexibility, resilience, positive thinking, and self-care. Then if a coping strategy, we should have a certain process. First thing, everything is based on an appraisal. Appraisal is nothing but an access the situation and its impact on your well-being. First thing is primary appraisal, evaluating the threat or challenges. Primary appraisal is evaluating the threat or challenges. Secondary appraisal is an assessing your ability to cope. And third one is choices, selecting the coping strategies based on the appraisal. Next one is implication, putting the chosen strategies into an action. Evaluation is assessing the effectiveness of the strategy and adjusting as needed. These are the coping processes. The next one is very important for an coping strategy is social support. A social support is an emotional, informational, and an tactile support for others. We have types, sources, benefits, and building a resilience which is important in the social support. Emotional support is categories of three types: listening, empathy, and encouragement. Then is instrumental support. Instrumental support is nothing but a practical help and financial assistance. Third one is information support. Information support is about advice, guidance, and education. Then the benefits of social support: reducing the stress and anxiety, improving the mood of and well-being, enhancing the coping skills and resilience, increasing the sense of belongings and connectivity. How to build and resilience? First thing is developing a strong support system network, practicing an effective coping style, and maintaining a positive outlook, taking care of an physical and emotional needs, learn from an experience and the challenges. Then we have two responses, clinical responses and psychological responses. These are the clinical reactions to the stress. First thing is physiological responses. We have about flight and fight responses, hypertension, tachycardia, sweating, muscle tension, and gastrointestinal issues. Flight and fight reaction is nothing but an active sympathetic nervous system relaxing the stress hormones like adrenaline and cortisol. Hypertension is an increasing of blood pressure. Tachycardia is a rapid breath. Sweating is an increasing of perspiration. Muscle tension is a tightening in the muscle. Gastrointestinal issues are like nausea, vomiting, diarrhea, or the abdominal pain. Next thing is psychological responses. Psychological responses is commonly as divided into anxiety, depression, mood swings, and cognitive impairments and disassociation. Next is hypervigilance, which is an exaggerated startle responses always on the outlook of a potential threat. Next one is, and the next and last one is avoidance behavior, which is an avoiding situation and or a stimuli that triggers the stress. Thank you.